Hello my dear friends, welcome to Anjali's Medical Education tutorial. Today we will be discussing cystic fibrosis. What is cystic fibrosis? What are the causes behind cystic fibrosis? What is the symptoms, signs and what are the diagnostic features to rule out this disease condition and how we can manage cystic fibrosis. So, cystic fibrosis is nothing but it is an autosomal recessive disorder due to the mutation of the cystic fibrosis transmembrane conductance regulator gene. So, the mutation of CFTR gene results in the incorrect activity by the exocrine gland. So, the CFTR protein is very much essential for the transport of iron across the cell membrane. This will create a channel so that the ions are easily transported across the cell membrane. So when this is hindered, the salt and the water, the ion is transported outside the cell, and that will lead to increased mucus production, increased salt content in the mucus and all. So that is the theory behind the cystic fibrosis. Now, we know that this can affect many organs in our body. For example, it can affect our lungs. When the lungs are affected, it will cause, or this CFTR protein is not there. So this is very much essential for maintaining the hydration inside the airways. So that is lost, and the mucociliary clearance is lost. So the mucus will get accumulated inside the airways, and thick and sticky mucus is produced because of this deficiency of this protein CFTR, and this get accumulated, and blockage of the airways result, and finally patient will be having difficulty to breathe and wheezing will be there. And when it is affecting the sinuses, sinusitis will result, and when it is affected in the intestine, the absorption of the nutrients is incomplete, and in pancreas it will block the pancreatic duct. The pancreatic enzymes is needed for the breaking of the food particles, so it is not functioning because CFTR protein is not there. It is absent because of the CFTR gene mutation. So that is the case, and kidneys are affected, and so these are the organs mainly that cause cystic fibrosis. Now okay, and other symptoms are clubbing fingers, developing or forming nasal polyps in the patient, malabsorption or incomplete absorption of the nutrients leading to poor growth in the patient, and infertility in both genders, and increased fat content in the stool, and infections will be there due to the accumulation of the mucus inside the lungs that is more prone for infection with the bacteria. So these are the symptoms of the cystic fibrosis. Now, how we can diagnose cystic fibrosis? In diagnosing cystic fibrosis, especially in newborn cases, immunotrypsinogen reactive test is available. If the content 16 nanogram, if it is greater than 16 nanogram per ml, it is considered as positive. And in that case, we will do a sweat test also. And in sweat test, if the sodium chloride content is greater than 160 millimolar per liter, then that is considered as positive. So genetic studies and sweat test for sodium chloride are the main tests for diagnosing cystic fibrosis. Now, how we can manage cystic fibrosis? In the management of cystic fibrosis, what all we should consider? The main problem will be, it will be affecting the lungs. So airway clearance is the primary motive in the case of cystic fibrosis. Airway clearance, how we can maintain clearance in the airway? Like bronchodilators can be used, and hypertonic saline can be used for nebulization so that the mucus can be forced out, and postural drainage techniques are available, and physiotherapy techniques such as vibration, percussion can be used to move out the mucus, and breathing exercises are available. And so these are the techniques that is mainly used for promoting airway clearance in the case of cystic fibrosis. Now, pancreatic enzymes supplement can be given because the pancreatic enzyme is affected. So we can give additional enzyme supplement through the medication. So that will do the function of the pancreatic enzyme. And another management is infection. For the infection we have to give antibiotic for the patient. So the antibiotics for the treatment of infection due to the accumulation of mucus is done. And lung transplant in severe extreme cases, when other medications is not possible or not responding, then the only option is the lung transplant. And nutritional supplements like high calorie fat, high calorie intake can be maintained in patient, and because fat is excreting a lot through the stool. And another important newer management in cystic fibrosis is the CFTR modulators. CFTR modulator drugs will do the primary function of the CFTR protein, so that this will create a channel so the ions can be transported across the cell membrane, and the thick sticky mucus is not generated. So there are mainly 4 CFTR modulators. So the CFTR modulator drugs, there are mainly 4 CFTR modulator drug, that is Trikafta, Simdeko, or Cambay and Calidico. The content in these drugs is like Ivacaftor, Lumacaftor, Dazacaftor and all. So I hope that you all understood what is cystic fibrosis, how we can, what is the cause behind cystic fibrosis, how we can manage, what are its symptoms, signs. If you all liked my video, found my video helpful, please do like, subscribe and comment. Let us see with another video very soon. Thank you so much and have a nice day.